Welcome back. We've all been working hard to do whatever we can to obviously protect ourselves from COVID-19. There's a ton of information out there. It can be confusing at times as you're trying to digest it. So with us now, we've got Dr. Taylor Mertz, a physician at Essentia Health, to clear up some of the information. So Doc, thanks so much for joining us today. Let's start with, there's so much sort of trepidation around this. How do you contract this virus, and just how easily does it get contracted?
Yeah, so this is a respiratory virus similar to influenza, how it's spread. So it's by droplet and contact. And so when somebody has the virus and they cough or sneeze, either directly on you or on a surface, and you touch it and touch your face, that's how you can get this virus.
Thank you.
The good thing is it's not airborne from what we understand. So that's where just breathing the same air could do it. But right now it seems more droplet and contact than anything. Thank
you for saying that, Doc, because I heard over the weekend there was a doctor out of New York who obviously is on the front lines of this whole thing, and he said that 99.9% of the people are going to be okay, assuming you don't have any underlying conditions. Again, I'm not a doctor, I'm just saying what he said, that as long as you're washing your hands, keeping your hands clean, and do not touch your face, you've got a really good chance of not contracting this. Would you agree with that?
I don't know about 99.9. I mean, we're seeing the rates, expand all over the country and all over the world. If you do get this, it's not a death sentence, right? That's kind of what we're seeing. The people who are older and the people who have underlying illness, they're the ones that are going to be most impacted by that. And that's why all of the precautions and everything that we're recommending and strongly encouraging people to do is really to stay home, right? To stay home if you're sick, to stay home even if you're well, if you don't have to leave, so you don't have that possible exposure.
One other thing, Doc, you hear a lot about, is there a possibility if I'm keeping my hands clean and I'm doing things to improve my immunity system, where I'm taking, vitamin C and zinc and whatever those things might be, can that help defend me as well from getting it?
Yeah, potentially. Just anybody who has a stronger or active immune system usually can fight off most illnesses a little bit better than somebody who's immunocompromised. And that's why young people, that's why it's hard to grasp this sometimes is, if I get it, I'm not going to be that sick. But what happens if you get it, give it to mom, give it to somebody who's undergoing chemotherapy, for cancer, they're the ones that are going to be most impacted. So just because it's not going to be me individually feeling it that bad, it's everybody else that we do come in contact with it. This is such a big deal for.
So what are some of the symptoms that people should be looking out for, and how many, I know this is going to be a guess on your part, but how many people are out there that you think are potentially asymptomatic?
Well, so the symptoms, it's a respiratory illness, and the most common that we're seeing right now are the fever and cough or shortness of breath. But like any other virus, you can have any of the other stuff. So headaches, body aches, sore throat. I guess some people have been reporting diarrhea now, but it's usually that initial respiratory, that cough and the fever that come with it. And you're asking how many people have it out there. That is really impossible to know right now because testing is where the biggest limits are. From the very beginning of this, when it first started showing up here in the U.S., we have not been able to test the amount of people that we should be testing. And you're seeing places like New York and New Orleans with numbers just exploding. And the reason why that is because now they have the availability of doing all these testing. Places like Minnesota, North Dakota, since we're later in the game on this, we're going to be able to eventually ramp up our testing, but we've been pretty limited to who we can actually test. And so guessing how many people have it, I'm not sure. So some of the things that I've been reading and hearing about are potentially 7 to 10 times more people currently have this than we know.
Doc, I got about a minute left. So just for clarity for our audience. So let's say that I'm out and I touch a handle or I touch something or I shake somebody's hand by accident. Do I need, if I just basically touch my face, am I going to put myself at risk, or am I talking about give me an idea how?
Yeah, the mouth, the nose, the eyes, any place that the virus can get in there. So that's the biggest thing, right? So if you're touching anything, wash your hands afterwards before you do that. I know all of us have the habit to just brush our nose or things like that. But when you're out and about, you're not at home, just making sure you're washing your hands, 20 to 30 seconds with soap or hand sanitizer, at least 60% alcohol is what the recommendation is right now.
Thank you. That's fantastic. And then how about washing down surfaces? Does it live on surfaces for 24 hours? I've heard 7 days. What do you?
I've heard lots of different numbers. It depends on what the type of the surface is. And since this is such a new virus, I don't think we have great answers for that. But if you do a nice disinfect and clean at home, doing that kind of regularly, not, every single day if you're not leaving the house. But if you have any other exposures, new people that do come to your place, I would definitely do that afterwards. But again, that shouldn't be happening right now, right?
Right.
So we're recommending everybody needs to stay home unless you have to leave.
Last question, Doc.
Social distancing is so important. 6 feet, just the people that you are not regularly living with, and just for essentials.
Last question, Doc. I know you talked about the airborne piece of this. What I'm hearing is that you've got to be in a room. I mean, if it's just strictly airborne, you're not touching each other, you've got to be in a room for a fairly extended time to have it transmit via airborne particles. Is that true?
It's not airborne from what I'm reading, and so just being in the same room is not what's important. That 6 feet rule is that if somebody does sneeze or somebody does cough, then you're much less likely for that to reach you.
Doc, thank you so much for the insight. We'd love to have you back, because unfortunately I think this thing's going to be over too soon. So if you join us again, we'd appreciate it, okay?
Yeah, thanks so much.
If anybody has any questions, Doc, can they reach out to you, Essentia, or what?
Yeah, so the biggest thing right now for what we are doing at Essentia is virtual care. That's what we're really trying to push, because we want people to stay home. And so if you have a concern that you might have COVID-19, we have e-visits. Right now they're free of charge, and it's basically answering questions. And then the provider will say, yes, you might have it, and if you qualify for testing or not. Right now, most of us do not qualify for testing.
Yeah.
And then on the other side of that is our virtual care. So that's why I have the headset on right now, because this is how I am taking care of my patients right now. So instead of coming to the office and potentially getting exposed, me getting you sick or you getting me sick, we're doing it through the computer like this, and it's been going great. We have a lot more time with the patients. They're loving it. People would much rather prefer to be on their couch in their pajamas instead of having to travel. So,
Doc, thank you so much for the time and the insight. We appreciate it very much. We look forward to having you back, okay?
Yeah, my pleasure.
All right, stay with us. We got much more coming up here on North Dakota Today, coming up right after this.